Your legs are not just something you stand on. They are the first place your body whispers to you before it ever decides to scream. My name is Dr. James Whitmore. I've spent close to 30 years with my hand on people's ankles, listening to what their circulation was trying to tell me. And I want you to understand something before we go one sentence further. By the time your legs start aching, swelling, tingling, or going heavy on you in the evening, a conversation has already been happening inside your body for weeks. You just weren't invited to it. Today I'm inviting you in. Here is the shocking part, and I want you to sit with it. In a person over 60, the legs are one of the most honest early warning systems. For the heart, the kidneys, and the blood vessels, 3 organs that almost never complain directly until it's very late. Your heart won't send you a text message. Your kidneys won't call you. But your ankles will quietly fill with fluid at 4 in the afternoon. Your calves will tighten when you walk to the mailbox, and one leg will start looking just slightly different from the other. That is the message. And most people over 60 are taught to ignore it, to call it old age, to rub it and move on. So let me put 3 big questions on the table, and I promise you, before this is over, you will have the answer to every single one. First, why do your legs feel light in the morning but heavy, swollen, and tired by evening? What actually changes across a single day? Second, why does a very common blood pressure pill, one that millions of people over 60 take, one called amlodipine, make ankles puff up like bread dough? And why do so many doctors forget to warn you about it? And third, this is the one that matters most. How do you tell the difference between the tired, harmless ache of both legs and the one-sided pain that is a genuine emergency? The kind where the clock is running and you don't know it. If protecting your future and your ability to walk on your own 2 feet into your 80s matters to you, then subscribe and give this a like right now, because what's coming next is the important part. And I don't want you to miss the section on that one-sided swelling. Stay with me. Now, let me explain something in plain language, the way I'd explain it to a patient sitting across from me with his shoes off. Blood is heavy, water is heavy, and gravity does not take a day off. When you are standing or sitting upright, everything liquid in your body is being pulled down toward your feet all day, every day. Here's the nuance most people never hear. Getting blood down to your feet is easy. Gravity does it for free. Getting it back up all the way from your toes to your heart, against gravity, that's the hard job. Against gravity, that's the hard job. That's the whole game. And your legs have a beautiful, underrated engineering system built exactly for that job. Listen to me carefully, because this next part is the foundation of everything. In your calves, you have deep veins, and inside those veins, you have little one-way doors. We call them valves. When you take a step, the muscle of your calf squeezes the vein like a hand squeezing a tube of toothpaste, and the blood gets pushed upward, toward the heart. Then those little one-way doors slam shut behind it, so the blood can't fall back down. Step, squeeze, push, close. Step, squeeze, push, close. Your calf muscle is, quite literally, a second heart. I say that to my patients and they think I'm being dramatic. I'm not. Sit in a chair for 4 hours without moving your legs and you'll feel exactly how much work that second heart was doing for you. Now here's where age walks in and changes the rules. After 60, and even more after 70 and 80, those little one-way doors inside your veins start to wear out. They get leaky. They don't slam shut the way they used to. So when your calf pushes the blood up, some of it now dribbles back down through a door that no longer closes properly. Over years, blood starts to pool in the lower legs. The pressure inside those veins climbs, and fluid gets squeezed out of the vessels and into the tissue around them. That fluid in the tissue, that's your swelling. That's the puffy ankle. That's the sock line that stays pressed into your skin an hour after you took the sock off. Doctors call the leaky valve problem chronic venous insufficiency, but you can just call it what it is. The return trip got harder. And now I can answer the first of the 3 questions I promised you, the one about mornings versus evenings. When you lie flat in bed all night, your legs are level with your heart. Gravity isn't pulling fluid down into your feet, so overnight your body quietly drains that fluid back out. That's why, and pay attention to this, many people over 70 get up 2 or 3 times at night to pass water. The fluid that's spent all day in your ankles is being reclaimed by your body while you sleep, sent to your kidneys and shipped out. So you wake up with slim, light ankles. You feel great. Then you stand up, gravity switches back on, and across the day, the fluid slowly loses the fight and settles back down into your legs. By evening, Back, your ankles are swollen and heavy again. It's not random. It's physics happening inside a body that's 70 years old. Here's a nuance I want you to hold on to, because it separates the harmless from the dangerous, and we'll come back to it hard later. Ordinary age-related swelling is almost always in both legs, more or less equal, soft, and worse in the evening. It's annoying. It's uncomfortable, but on its own it is usually the return trip got harder story. The moment it becomes one leg, suddenly with pain and warmth, that's a completely different animal, and I'll show you why that one can't wait. Let me tell you about a patient, because I learned this lesson standing at a bedside, not reading it in a book. Years ago, early in my career, a man of 73 came to me. I'll call him a retired school teacher because that's close enough. He'd had both ankles swelling for months. Every doctor told him the same thing: elevate the legs. He was also told to cut the salt and to wear the stockings. But nobody had listened to the whole story, because his swelling wasn't just gravity. His swelling was also his heart. And that brings us to the second organ your legs are reporting on, the one nobody thinks about when they look at a puffy ankle. Here's the thing about the heart and the legs, and I want you to really hear this. Your heart is a pump. Specifically, the right side of your heart is the side that receives all that blood coming back up from your legs and sends it to the lungs. Now, what happens if that pump gets weak? If it's tired? If it's been fighting high blood pressure for 20 years? It can't keep up with everything coming back to it, so the blood backs up. It backs up in the veins. The pressure rises. And where does the overflow show up first? At the lowest point. The ankles. The feet. This is why one of the earliest, quietest signs of a struggling heart in a person over 70 is not chest pain at all. It's swelling in the legs and shortness of breath climbing the stairs. In my practice, I have caught more than one failing heart, not with a stethoscope on the chest, but with a thumb pressed into an ankle. Let me show you the little test I did on that school teacher. The same one I'll teach you right now, because you can do it tonight. Press your thumb firmly into the front of your shin bone, just above the ankle, for about 5 seconds. Then let go and look. If your thumb leaves a dent, a little crater that slowly fills back in, that's what we call pitting. That dent is fluid, and the deeper and slower that dent is to fill, the more fluid your body is holding in places it shouldn't. When I pressed on that man's shin, my thumb sank in like it was pressing into fresh dough, and the crater sat there for a good while. That told me this wasn't just leaky veins. This was volume. This was a heart and a set of kidneys that weren't clearing water the way they should. And here is the trap. And I want you to remember the word trap because we're going to open a lot of them today. The trap is this. The treatments for these different causes are not the same, and some of them work against each other. Elevating your legs and wearing compression stockings is wonderful for leaky veins. But if the real problem is a weak heart holding too much fluid, stockings alone won't touch the root of it. This is exactly the kind of thing that gets settled in a cabinet in 10 minutes, and I wish more people knew to ask. Now, while you're sitting there thinking about your own ankles, and I know you are, I can practically see you pulling up your pant leg to look. There's a process I haven't mentioned yet that is happening right now in the walls of your smallest blood vessels, a slow stiffening that started years before any swelling ever appeared. And it changes everything about how your body handles fluid after 60. I'm going to open that up in just a moment, but first I have to tell you about a pill, because there's a very good chance it's sitting in your medicine cabinet. And there's a very good chance nobody explained this one detail to you. The pill I want to talk about is called amlodipine. If you're over 60 and you take something for blood pressure, there's a real chance this is it, or something in its family. The calcium channel blockers, we call them. And let me be clear, because I don't want a single person turning this into fear. Amlodipine is a good drug. It has protected millions of hearts. I have prescribed it myself many times to people I care about. But there is one specific side effect that gets missed in the exam room over and over, and it sends people into a panic that they don't need to have because they think their heart is failing when it isn't. So let me be the doctor who actually explains it. Here's how amlodipine works, in plain language. High blood pressure is, in part, your arteries being too tight, too clenched. Amlodipine tells the muscle in the walls of your small arteries to relax and open up. Wider pipes, lower pressure. Wonderful. But here's the nuance nobody tells you at the pharmacy counter. When amlodipine relaxes those little arteries, it opens the front door of your tiniest blood vessels, the capillaries, a little wider than it opens the back door. So more fluid gets pushed into the tissue of your legs than gets pulled back out. And where does it settle? You already know. The ankles, the feet, back, puffy, swollen, and it looks for all the world like heart trouble. Now listen to me carefully, because this is the part that saves people a sleepless night. Amlodipine ankle swelling and heart failure swelling can look similar to the eye, but they are not the same thing, and telling them apart is the doctor's job, not yours to guess at, and not something to stop your pill over on your own. Here's the difference I look for. Amlodipine ankle swelling usually comes on in both legs, fairly equally, and it does not come with getting short of breath when you lie flat at night. Heart swelling more often travels with breathlessness, with needing extra pillows to sleep, with a cough at night. In my practice, I have had patients terrified they were in heart failure, and the whole problem was a dose of a blood pressure pill that opened those capillary doors a little too wide. We adjusted things, and the ankles came down within weeks. But, and here is the trap, and it's a nasty one. I have also seen it go the other way. I have seen people blame the pill, quietly stop taking it without telling anyone, because their ankles were puffy and they read something online, and their blood pressure, no longer held in check, climbed right back up into dangerous territory. Do you understand the ambush there? A harmless swollen ankle scares you into stopping a drug that was protecting your brain and your heart from a much worse fate. Never, and I mean never, stop a blood pressure medication on your own because of swelling. You call the person who prescribed it and you say 2 words, "My ankles." That's it. That sentence starts the right conversation. There are ways to handle it. Sometimes it's a smaller dose. Sometimes it's pairing it with a different type of medicine that closes that back door and lets the fluid drain. Sometimes it's a completely different drug. But that's a decision made with your doctor, not with your fear. Let me tell you something my colleague, a sharp fellow I've worked alongside for years, once said to me over coffee. He said the swollen ankle is the most misread sign in all of medicine over the age of 70, because 4 different problems all knock on the same door. Leaky veins knock, a tired heart knocks, a blood pressure pill knocks, and the kidneys knock. 4 different visitors, 1 doorbell, and the person who just guesses which one it is, who just decides it's my heart or it's the pill and acts on it alone, that person is playing a game they can't win. Now let me open up that stiffening I promised you a few minutes ago, the one happening in your vessel walls right now, because it ties all of this together. When you are young, the walls of your arteries and the tiny vessels in your legs are springy, elastic, forgiving. They stretch and recoil like a fresh rubber band. But across the decades, 60, 70, 80 tests, those walls slowly stiffen and thicken. Calcium and other deposits work their way in. The rubber band becomes more like an old garden hose that's been left out in the sun, cracked and rigid. Here is the consequence nobody explains. A stiff vessel doesn't manage fluid well. It doesn't respond as smoothly. It doesn't recoil to help push blood along, and it leaks pressure into places it shouldn't. So the very same amount of fluid that a 50-year-old's legs would handle without a blink becomes a swollen, aching ankle in an 80-year-old. The legs didn't change their habits. The pipes got old. And this is why I keep hammering on the number 60, 70, 80, because the exact same lifestyle, the exact same pill, the exact same glass of salty soup lands completely differently on an 80-year-old body than on a 40-year-old one. The margin for error shrinks. The systems that used to quietly fix things overnight now do it slower, or not completely. Your body at 80 is not a broken version of your body at 40. It is a body with less spare capacity, less cushion, less room to absorb a mistake. That's not doom. That's just information. And information is the whole point of understanding your legs, because your legs are where that shrinking margin shows up first and shows up clearest. Let me give you the practical side now because I don't want you leaving here with only anatomy and no tools. If your swelling is the ordinary evening kind, both legs, soft, worse at night, better in the morning, there are things that genuinely help, and they're not expensive. First, move that second heart. Every hour you're sitting, do 10 slow ankle pumps. Point your toes down, then pull them up toward you, like pressing a gas pedal and lifting off. That squeezes your calf muscle and works those valves for you. I've had patients cut their evening swelling nearly in half with nothing more than that, done faithfully. Second, elevate. And I mean properly elevate. Legs above the level of your heart, not just up on a footstool. 20 minutes twice a day, lying back with your calves propped on pillows. Gravity works for you in that position instead of against you. Third, and this is the one people resist, compression stockings. I know. They're a nuisance to get on, especially over 70, especially with arthritic hands. But listen to me. A proper medical compression stocking is like a firm hand wrapped around your calf all day, helping those worn-out valves do their job. It is one of the most effective things we have for tired, leaky vein legs, and it costs a fraction of any pill. The nuance, and there's always a nuance, is that if you have poor artery circulation, the wrong strength of stocking can do harm, which is why the strength should be chosen with your doctor, not grabbed off a shelf because it looked about right. That word again. Always with your doctor. And salt. I have to talk about salt, and I have to do it honestly, because there's a myth floating around that I need to correct. People think if they stop pouring salt from the shaker, they've handled it. Here's the truth. You think cutting the shaker is enough? You've just opened the door to the sneakier villain. The salt that swells your legs isn't mostly on your table. It's hidden in the bread, in the canned soup, in the deli meat, in the healthy frozen dinner, in the very foods marketed to older people as gentle and easy. That's where the sodium lives. And sodium pulls water and holds it in your tissue like a sponge. So a person over 70 can salt their food modestly and still be swimming in hidden sodium from 3 processed meals a day. Reading the label on the package does more for your ankles than moving the shaker off the table ever will. Now, I've spent all this time on the veins and the fluid, the return trip, the leaky doors, the tired pump, the pill that opens the capillary door too wide. But there is a whole other reason legs hurt after 60, and it's the opposite problem. It's not about blood struggling to get back up. It's about blood struggling to get down there in the first place. And that problem doesn't announce itself with swelling. It announces itself with pain when you walk that stops when you stand still. And if you've ever felt that, I need you to keep listening, because that particular pattern is a warning sign about the arteries feeding not just your legs, but your heart and your brain. Let me open that door next. The pain I'm talking about has a very particular fingerprint, and once you know it, you can never unknow it. It goes like this. You start walking to the shop, up the street, across the parking lot, and after a certain distance, always about the same distance, a cramping, tight, aching pain builds in your calf. Sometimes the thigh, sometimes the buttock, but classically, the calf. It gets bad enough that you have to stop. And here's the tell. Here's the whole thing. Within a minute or two of standing still, it eases off completely. Then you walk again, and at the same distance, back it comes. We call this claudication. And what it is telling you is stark and simple. Your leg muscles are not getting enough blood when they work. Let me explain the plumbing, because it's the mirror image of everything we've discussed. The veins were about blood getting back up. Now we're talking about the arteries, the pipes that bring fresh, oxygen-rich blood down to the muscles in the first place. When those arteries get narrowed and clogged with plaque over the decades, they can still deliver enough blood while you're resting. But the moment you walk, your calf muscle demands far more oxygen, and the narrowed pipe simply can't deliver it. The muscle starves. Starved muscle screams. That scream is the pain. You stop. The muscle's demand drops back down. The trickle of blood catches up, and the pain fades. Peripheral artery disease, we call it. And here is why I need you to take it seriously in a way most people don't. Listen to me very carefully. If the arteries in your legs are clogged enough to cause that pain, it is almost never only your legs. The same disease process that narrowed the pipes in your calf is very likely narrowing the pipes that feed your heart and the pipes that feed your brain, because it's the same plumbing, the same body, the same decades of wear. In my practice, and this is not a statistic I read, this is what I have watched with my own eyes. The person who comes in complaining about calf pain when they walk is a person I immediately start thinking about differently, because their legs just handed me a warning about their whole cardiovascular system. Their legs became the canary in the coal mine. That leg pain is your body's way of telling you about a fatal risk that has nothing to do with your legs at all. This is the kind of thing that rarely gets spelled out plainly in a 10-minute appointment. And it should be. There's a simple thing your feet can tell you here, and you can check it tonight. Take off your socks and really look at your feet and lower legs, both of them side by side in good light. In poor artery circulation, the skin on the feet often becomes shiny, tight, and hairless. The hair on the toes and the top of the foot thins out or disappears because even the hair follicles aren't getting enough blood. The foot may look pale when you raise it up and dusky red when you hang it down. The toenails may grow thick and slow, and a cut or a sore on that foot may heal terribly slowly, or not at all. If you're seeing that picture, shiny, hairless, cool, slow healing, that's your arteries talking, and that's a conversation to have with your doctor sooner rather than later. Not tomorrow in a panic, but this week with purpose. Now I have to bring in the one condition that sits underneath so much of this and makes everything worse, quietly, in the background: diabetes. And I want to handle this carefully, because half of what makes diabetes dangerous to the legs is that it hides. Here's the trap. High blood sugar over years does two cruel things to the legs at the same time. First, it damages the small blood vessels, making that whole circulation problem worse. But second, and this is the truly dangerous part, it damages the nerves. The nerves in the feet go numb, and a numb foot is a foot that can't feel a warning. A pebble in the shoe, a blister, a small cut, a burn from a heating pad or from bath water that's too hot. A person with healthy nerves would feel it instantly and react. A person with diabetic nerve damage feels nothing. The injury sits there, unfelt, on a foot that already has poor circulation and heals slowly, and it grows into something serious before anyone notices. Let me be blunt about why this matters so much after 60. The combination of numb nerves plus poor circulation is exactly how a tiny, silly injury on a foot turns into a wound that won't heal, and how a wound that won't heal turns into the kind of outcome that costs a person their mobility, or worse. I have seen it start with something as small as a toenail cut a little too short. That is why, if you have diabetes, checking your feet is not optional, and it is not fussy. It is one of the most important things you do all day. Every single evening, look at the soles, between the toes, the heels. Use a mirror if you can't bend, or ask someone. You are looking for anything: redness, a blister, a cut, a hot spot, a color change, because your feet may have lost their ability to warn you with pain, so your eyes have to do the warning instead. Now let me bring in another pill, to keep our promise. Because I told you at the start we'd talk about the medicine cabinet honestly. Many people over 60 take lisinopril, or a relative of it, the ACE inhibitors we call them. Like amlodipine, it's a good drug, and it does something amlodipine doesn't. It genuinely protects the kidneys in a lot of patients, especially those with diabetes, and it protects the heart. But it comes with its own quirks that people are rarely warned about. The famous one is a dry, tickling, persistent cough. Not a cold, not the lungs, just a nagging dry cough that some people develop weeks or even months after starting it. I've had patients get worked up for every lung condition under the sun when the answer was sitting in their pill bottle. If that's you, again, you don't stop it yourself. You mention it, and there are clean alternatives. But here's the more important nuance with lisinopril. and it ties straight back to your legs and your kidneys. The fourth visitor at that doorbell I mentioned earlier. Your kidneys are the master fluid managers of your whole body. When they're working well, they decide exactly how much water and salt to keep and how much to send out, and that decision is a big part of whether your ankles are slim or swollen. As the kidneys age, and especially if they've been battered by years of high blood pressure or high sugar, they get worse at that job, and fluid backs up into the legs, again, right where we started. Now, drugs like lisinopril work partly through the kidneys, and they can shift the body's balance of potassium. Too much potassium is genuinely dangerous. It can affect the rhythm of your heart. This is why the person on these medications gets their blood checked periodically. Not because anyone's being overcautious, but because the kidney, the pill, and the heart are all tied together on one string, and your legs are often the first place that string shows its tension. Do you see the pattern now? The thing I've been building toward this whole time? The tired heart, the leaky veins, the clogged arteries, the aging kidneys, the blood pressure pills, the hidden salt, the numb diabetic nerves. They all converge, all of them, right down there at your feet and ankles. Your legs are the crossroads where the whole cardiovascular and kidney story becomes visible, becomes touchable, becomes something you can actually look at in the mirror tonight. That is why I open by telling you they're an honest early warning system. They're not lying to you. They're just speaking a language nobody taught you to read, until today. But I've saved the most important thing for last, and I need you to still be with me, because everything up to this point has been about the slow patterns, the evening swelling, the walking pain, the gradual stiffening. Those are the conversations that unfold over weeks and months. Now, I have to tell you about the one that unfolds over hours, the one where waiting is the mistake. Because there is a specific way your legs can hurt that is not a warning about next year. It's a warning about the next few hours. And mistaking it for ordinary tiredness is exactly how good people miss the moment that mattered most. Let me show you what it looks like. Everything I've described so far, the swelling, the aching, the heaviness, has one thing in common. It shows up in both legs, more or less together, because gravity and aging pipes and salt affect both sides of your body at the same time. So here is the single most important sentence I will say today, and I want you to write it on your heart. When it's suddenly one leg, one calf that becomes swollen, warm, tight, and painful, while the other leg looks completely normal, that is not ordinary tiredness, and that is not a wait and see. That is the pattern of a blood clot in a deep vein of the leg, what we call a deep vein thrombosis, and it can turn into a genuine emergency very, very quickly. Let me tell you why, in plain language, and then I'll tell you exactly what to look for. A clot forms in one of those deep veins in your calf or thigh, often after a long period of not moving, a long flight, a long car ride, a stretch of illness in bed, or sometimes for reasons we can't fully see. That clot blocks the return flow so that one leg swells and aches while the healthy leg stays normal. That's the part you can see. Here's the part you can't. That clot is not always content to stay where it formed. A piece of it can break loose, travel up through the veins, through the right side of the heart, and lodge in the lungs. And that, a clot in the lungs, is one of the ways a person over 60 can go from feeling basically fine to a fatal outcome in a matter of hours. This is not me trying to frighten you. This is me trying to make sure you recognize the one pattern where the clock is actually running. So listen to me very carefully, because this is the checklist that could matter most. The warning pattern of a leg clot is one leg, not both. Swelling that came on over hours or a day or two, not the slow evening puffiness. Pain or tenderness, often in the calf, sometimes described as a deep cramp or Charlie horse that won't quit. Warmth. The affected calf feels hotter to the touch than the other one, and sometimes a reddish or bluish discoloration of the skin. If a piece has already traveled to the lungs, you may get sudden shortness of breath, sharp chest pain that's worse with a deep breath, a racing heart, or coughing. Those lung signs are the alarm bells that mean you do not drive yourself anywhere and you do not sleep on it. You get emergency help immediately. Here's the trap. And it's the cruelest one of the whole day, so hold on to it. A leg clot can feel at first almost exactly like the muscle cramp you've had 100 times before. That's the ambush. The person thinks, I just pulled something, I'll rest it, I'll rub it, it'll pass. And they lie down. And rubbing a clot is one of the things you should never do because it can help dislodge the very piece that travels to the lung. So let me make the rule dead simple, simple enough that you'll remember it under stress. Sudden, one-sided, swollen, warm, painful calf. You don't massage it. You don't wait it out. You get it checked today, not next week. That single instinct, choosing the phone over the heating pad, is the kind of decision that quietly saves a life and nobody ever knows it did. And the small things stack up. Don't sit motionless for hours. Set an alarm. Get up. Do your ankle pumps, that second heart I told you about. On long trips, move your feet and get up when you can. Keep the hidden salt out of your diet by reading labels, not just skipping the shaker. Elevate your legs in the evening. Wear the compression your doctor approves. Check your feet every night if you have diabetes. And take your blood pressure medications exactly as prescribed. And when something feels off, when the ankles swell or the cough starts, you don't quit the pill in silence. You make the call. Every single one of those is small. Every single one is free or nearly free. And together they are more powerful than most people over 70 ever realize. Now, I promised I wouldn't leave you standing in fear, and I won't. Because the beautiful thing is that so much of this is preventable with the plainest habits imaginable. Move. That is the whole secret to your veins, and half the secret to your arteries. A body that moves does not let blood sit still long enough to clot easily, does not let fluid pool, and slowly coaxes new little blood vessels to grow around the clogged ones. Walking is medicine, real medicine, the kind that comes in no bottle. For claudication, for that walking pain, the treatment is, counterintuitively, more walking, done in a structured way with your doctor's guidance. Walk until the pain starts. Rest. Walk again. Over weeks, the distance you can go grows because your body builds new supply lines. Your legs, given the chance, will try to heal themselves. Your job is to give them the chance. So let me bring you all the way back to where we began. I told you at the very start that your legs are one of the most honest early warning systems your body has. That your heart won't text you and your kidneys won't call you, but your ankles will fill with fluid. Your calves will tighten when you walk, and one leg will look just slightly different from the other. Now you understand why. Now you know that the evening swelling is the return trip getting harder, that the puffy ankle might be a pill or a pump or a kidney, that the walking pain is a warning about your whole cardiovascular system, and that the sudden one-sided swollen calf is the one where the clock is running. Your legs were never just something you stand on. They were talking to you the whole time. The only thing that changed today is that now, finally, you can hear them. I'm Dr. James Whitmore. Take your shoes off tonight, look at your feet in good light, press your thumb into that shin, and really see them. Because they've been carrying you your whole life, and they deserve a doctor who listens. And now, so do you.